As the demand for COVID-19 testing has decreased, the city has announced that the testing and vaccine site at the Joseph Lee Center is closing at the end of the month. It's as the governor says, the state will not help distribute vaccines as well to young kids. News4Jax reporter Joe McLean is joining us live with more on this. Joe?
Yes, so the last day to get vaccinated or get a test for COVID-19 here at the Joseph Lee Center is June 30th. The reason the Duval County Health Department says it's shifting its focus to provide COVID services to specific areas of town. Florida's governor reaffirming his stance Thursday that his administration will not recommend the COVID vaccine for young children. The decision as U.S. regulators are poised to green light a vaccine for the youngest age group yet, from 5 years to as young as 6 months.
There's not going to be any state programs that are going to be trying to, get COVID jabs to infants and toddlers and newborns. That's not something that we think is appropriate, and so that's not where we're going to be utilizing our resources in that regard.
In a Senate committee hearing today, the leaders of the CDC, the FDA, and other public health agencies told lawmakers that the country should prepare for what might happen next. Senator Patty Murray is the committee's chairwoman.
The reality is we are already running out of resources to prepare for the fall, and we are running out of time to fix that. We need to continue to support a full, robust response. This is simply too important to scramble again on short notice or shortchange our communities.
The CDC says 2/3 of Americans now live in a county that's considered medium or high community levels of COVID-19. Duval is one of those counties considered high community transmission. And because of that, certain members of NASJAX will have to mask up again. Still, Dawn O'Connell, a top official at the Department of Health and Human Services, told the committee today,
while COVID has been anything but predictable, today we are in a much better position to respond than we were a year ago. A big reason is because Congress, on a bipartisan basis, provided the resources needed to make sure Americans had these free and widely available tools to protect themselves.
Those resources O'Connell mentioned, she said, if those dry up, if they're not renewed and continued, then the country's ability to respond to another COVID variant or another new virus is going to be severely limited. Reporting live, I'm Joe McLean, Channel 4, the local station.
Joe, I understand you've also been checking in on COVID patients at local hospitals. What are you hearing?
Right. Across the state, the latest reports are showing more than 3,200 COVID patients are in Florida hospital beds right now. And that is a slight increase over last week, about 14% jump over the same day last week. Back to you.
Joe McLean reporting to us live this evening. Thanks, Joe.